Hello, my name is Madeline Rivera, and I am presenting with my partner, Caitlin Snodgrass. We are presenting on the hepatitis C. Hepatitis C is a viral infection which is predominantly affecting the liver. It continues to be one of the most popular viral infections, posing a great global threat to the United States. The word hepatitis is a derivative from the Greek word hepatos, defined as liver. Therefore, it's referring to inflammation of the liver. Hepatitis C is one of 5 different strains of hepatitis. However, hepatitis C differs in the mode of transmission and the preventative measures. Hepatitis C is a blood-borne virus, meaning that it is spread through blood-to-blood contact, which opens the door to a variety of different risk factors. Hepatitis C is also accompanied by acute or chronic symptoms. It is characterized by sole inflammation of the liver. In this image, you can see that there is a comparison of the healthy liver and the hepatitis C liver. The longer the symptoms occur, the more damage there is to the liver. You can see that there's scarring in comparison to a healthy liver. Hepatitis C is caused by the disease agent hepatitis C virus. It is a spherical single-stranded RNA hepatotropic virus, meaning that it only affects the liver in humans. It predominantly attacks the liver, which leads to long-term health effects. It occurs when there is adaptive immunity invasion to the normal cells within the body. The symptoms occur as acute or chronic infection, depending on the length of the symptoms. The mode of transmission is, again, through blood-to-blood contact. Some of those examples include shared needles, commonly in street drugs, and even in tattoo shops. Another one would be through contaminated blood when there are blood transfusions. However, contaminated blood is not as common because there are better screening processes now. Another one would be risky sexual activity. When there is not safe sex practice, there are more risk of blood-to-blood contact. Blood-to-blood contact in sexual activity is more common in male-to-male sexual contact due to the risk of blood exposure. HCV can also be transmissible from a mother to her newborn baby. That is not through breast milk, but rather in utero. As far as the symptoms, the symptoms they can occur as soon as 12 weeks and as late as 6 months. So symptoms occurring within the first 12 weeks would be a more of an acute case. However, acute cases are not commonly detected because there are not symptoms. So usually symptoms are incurred during the more chronic stages, which would cause people to go be tested. And then by the time they are tested, it is already a chronic stage. When it is in the chronic stage, it is already experiencing damage to the liver in comparison to an acute stage where the body is still able to have an immune response to attempt to fight the infection off. If the body is unable to fight the infection, it begins affecting the liver more and puts the liver at risk of scarring. As far as the prevention and intervention, this is where hepatitis really varies in comparison to the other strains. As far as the prevention, there is not currently a hepatitis C vaccine, although there is vaccines for the other strains of hepatitis, which are recommended to get. However, there are routine hepatitis screenings, which the CDC recommends by the age of 18. Therefore, people would be allowed to get more early detection of the hepatitis C rather than allowing it to be detected at a chronic stage. Another one would be education and just raising awareness on hepatitis C and also informing people of the modes of transmission and informing them that they should practice safe sex measures while also being safe when it comes to a healthcare setting where needles are exposed to multiple people. Another for the intervention usually occurs when the state is chronic. When it's chronic, they administer direct acting antiviral medications, which are able to cure the hepatitis C in its chronic stage. However, the effects on the liver cannot be reversed if they are too far gone. The amount of medication is also determined on the effects on the liver, and that's how they determine which medications they will prescribe to each person affected by hepatitis.
All right, my name's Caitlin, and I'll be talking about the rest of the presentation. Basically, so going into some environmental factors, because HCV is usually a chronic or acute disease that's like a bloodborne disease, it's not really affected by sort of seasonal trends, similarly to how other viruses, like maybe the flu or COVID, would be, where they have a season where they're more prevalent. HCV is just the prevalence comes from infection due to bloodborne like contact. So it usually is developed slowly over time from a one-time exposure to infected blood. And then I did find a study that shows it basically researches vitamin D in the winter season with HCV patients because in the winter season, it's commonly known that there is a lack of vitamin D just because there's less sun. And so that does have a little bit of a negative effect on HCV patients just because of some of the functions of what vitamin D does. But besides that, there's not really an environmental factor that's super connected to HCV. So then going into disease distribution, basically, um, acute cases are kind of acute and chronic cases are both common for HCV, and acute cases sometimes some of them don't actually end up developing into chronic, but most of them do. So in the 1980s, there was 230,000 acute cases diagnosed per year, which is a lot. A lot of it was even due to infected like blood don people donating their blood that was infected that wasn't screened as well as it should have been. But now we have a lot of preventative measures there, so that's not as much of a risk. But that number decreased significantly by the early 2000s, and now it's only about 28,000 to 36,000 acute cases, which is usually not because of people getting blood transfusions, but more so people having unprotected sex or just being infected from another measure, such as like sharing needles from drugs or even just like in a medical setting. Um, and then HCV is known as the number one cause of death for liver disease because it does cause cirrhosis of the liver, and it is the most common thing that affects the liver. So, morbidity, there's approximately 2.4 million adults that are living with chronic HCV in the United States, and they are getting treatment, most of them, and some of them are just living with it. And then the goal basically that was established by this study by Hall in 2021 was to reduce the death rate to approximately 4.17% for every 100,000 people who are diagnosed would actually um, end up with chronic HCV. And so then going into mortality, we see that in 2018, there was approximately 15,000 people in the United States who died from HCV. And then in 2020, the death rate was still above 4.17% for every 100,000 people. And so the goal is to just keep decreasing that percent number. And it has decreased significantly in the past 20 years, which is really good. Um, but approximately 242,000 people worldwide have still died from this, kind of as like an average number per year, just because in other countries there's a lot less access to healthcare. in comparison to America. And so it does affect those populations a lot more significantly. And then there are some treatments. There was one that I found that was approved by the FDA, and it's an interferon treatment that consists of regimens that are based off of fast-acting antiviral drugs that can successfully mitigate or eradicate the symptoms altogether. And that is a newer study that is continuing to be used and is helping to treat a lot of HCV cases. And then social determinants. The most common age group overall across America is people between the ages of 45 and 65. And that is partially because people are developing symptoms like later than when they first were exposed to it, but also just because that's the just a common age for people's livers to them to start noticing the effects of damage to the liver. And then women are less likely than men to develop HCV, and so they're they're going to be only 35.6% of the cases are women. And then it's going to be most common in African Americans, Asians, and Caucasian ethnic races, just because the most cases have been seen in those. And it's also significantly higher in African Americans. Then also specifically for Los Angeles County and LA specifically, it seems based off the research that I did that the thing that differs LA County from like the rest of America is that a lot of the populations diagnosed are younger people, and the hypothesis for that is that it's more connected to drug use and like sharing of needles or unprotected sex, and that's why it's more of a younger population that's being affected by it in LA specifically. And so overall, HCV is going to be a viral infection that is transmitted through blood. It's going to affect liver health. It can lead to long-term liver damage and cirrhosis. The symptoms that occur right away, or it can take significantly longer for you to see or maybe notice that that is what's really affecting your health. And then antiviral medications and screenings will help with prevention and intervention. The morbidity and mortality have been decreasing as more treatment and awareness is spreading. In the past 20 years, they've decreased a lot, but it is still a prevalent concern. And the treatment is helping, but there are still people who are dying from it. And then what is being done currently, there's more research that's being done, as Madeline mentioned, trying to develop something like a vaccine that could help with this, or increasing awareness and education regarding the risks of the effects of HCV, then increasing the effectiveness of prevention tactics and education, creating more protocols for handling blood in a safe way, and that could be in like a hospital environment or a blood donating environment, um, and then create or detecting infection earlier and attempting to implement treatments to help, such as the interferon treatment that I just explained. So the earlier that we can prevent and be aware of HCV, the better the prognosis will be in the long run. And so just increasing awareness about safe sex and not sharing needles and just avoiding coming into contact with other people's blood is definitely the best places to start with preventing HCV. Thanks for listening. And here is our references.